I'm sorry, I got called away. Let me wash my hands again and we'll continue. Earlier I could not finish out your hearing test, but I did not have a tuning fork, but I managed to snag a tuning fork while I was out, so I want to go back to that real quickly. Basically, I'm going to strike this tuning fork to make it vibrate. I'm going to place it on the top of your head. I need you to let me know whether you feel and hear that vibration in both ears, okay? And tell me when you hear it stop. Okay? Next, we're going to do the same to the side of your head. We're going to place it on your maxillary bone, and once that you stop feeling the vibration, I want to actually hold it in front of your ear. I want you to tell me when you stop feeling the vibration and then when you stop hearing the vibration behind you. Okay? Other side. Great. So now can I get you to scoot forward just a little? I just need to be able to touch the back. So I'm going to have my hands on your back, and every time that I move my hand, I would like for you to say, um, like for you to say, E, please. 99 now. And I feel that it's being non-clear, kind of a muffled sound. Again, do the E again, please. Yeah. And again, it should sound non-clear. Also need to do. Can I get you to say 1, 2, 3? Thank you. And again, that should be hardly um, audible to me. Okay. Um, Now we need to do your interior chest. Again, can you say 99? 99. So now I need to listen to your heart. And you'll notice that I will both use the diaphragm and the bell. The diaphragm I will use first to hear your heart in different spaces, different locations rather, and then I will go back to the bell just to make sure you don't have any heart murmurs, okay? So I'm going to go to the patient's right side of the sternal border for the aortic. Patient's left side of the sternal border for the pulmonary. Second intercostal, I'm sorry. We'll drop down and over a little bit for Erb's point. Down to around the fourth for the tricuspid. And I'm sorry to ask, can I get you to lift your boom slightly? Thank you. And this is to check for your cool. Great. Now we'll go back to those same spots and just check for heart murmurs. time if I could get you to lift your legs. Thank you. And you need to report my findings on that, your rhythm. So give me just a second, let me write that down. Okay. Now I need to get you to lay down on the table. We need to do an abdominal assessment. With your abdomen, we do things a little bit differently. We are going to inspect visually, and then I'm going to listen to the quadrants, and then we'll do some percussion and palpation. Okay? So we inspect her abdominal area to see if there's any, it needs again to be symmetrical, no areas of bulging, hernias, any kind of deviations like that. We also want to pay attention to see if we see any problems with her AAA. Don't really want to see any kind of pulsation going on under the skin. You know, basically, like I said, first we do a visual inspection, and then we're going to go ahead and listen to her bowel quadrants. The reason we do that is if we go ahead and start percussion or palpation, then we can affect our bowel sounds. So we're going to start with the patient's lower right quadrant, and we're going to listen up to 5 minutes to hear bowel sounds. We're going to go to her right upper quadrant. Her left upper quadrant. And her left lower quadrant. I'm also going to listen for her aortic, which is midline, and then I would normally listen to her femoral arteries. And again, would listen both with the diaphragm and then go back with the bell for any bruits. Then we're going to go ahead and percuss. It's kind of in a figure 8 pattern. And then we would palpate, again, starting with her lower right quadrant. And we typically do not do deep palpation. Specialized nurses do that, but we do light palpation. And we would want, right here under the edge of the ribs, we'd want to pay attention if we feel something or heard something in percussion for enlarged liver in this area. Obviously with her appendix, McBurney's points are over in this area. Those are the things we would take note of. Behind you, I want to just tell me if you feel any tenderness. Just checking any inflammation. Okay, I think that's where we're going to stop for today. I thank you for your time. I'm sorry that we got interrupted. When you come back next trip, we will go ahead and do more on the cranial nerve and on your extremities, check range of motion, and your reflex. Any questions for today? The last thing I need to ask you, have Have you had your yearly breast exams? You have your mammogram. And have you been sexually active, so are you getting pap smears every 2 to 3 years? Do you know how to do a home monthly breast exam? Are you familiar with the process? Okay. Do you have any other questions? Thank you very much.